Hello, my name is Patrick Martin, and I'm the Assistant Superintendent for Operations and Services here at Vestavia Hills City Schools. Right off the offset, I want to make sure that we are thanking our coaches, our sponsors, and other individuals that are going to be helping to bring students back to activities here in the summer of 2020. These are unprecedented times, and we certainly appreciate your efforts in making this a special experience for them. This video is broken out into 3 different components. This first component is really going to be over general guidance. In our second portion, you're going to hear from Nurse Brenda Seale, who's going to talk with you about monitoring students. And then our final portion is going to be making sure that we have clean environments for the students to participate in. In terms of our general guidance, we're here at Vestavia Hills High School, and this is going to be where we will start on June 1st, welcoming students back in the area of athletics with their different sports teams. One area of note that we need to make sure that we are policing on a regular basis is that when students arrive at the different sites, they need to go straight to the space where they're either going to be doing workouts or having their other experience. After an experience is complete, practice or workout or working out with one of our other sponsors, we need to make sure that those students are heading straight to cars. So if they are going here at the high school, they need to go straight to their personal vehicle. If this is at one of the middle schools, they need to head straight to their parent or guardian's vehicle. We should not have students hanging around in parking lots having conversation. Likewise, we should not have parents, guardians, or other outside individuals coming into our spaces. So we need to make sure that it's perfectly clear for parents and guardians that only students are going to be admitted onto the campuses. All right, let's talk a little bit about the spaces that are going to be available for our student athletes and other participants. We are actually going to have locker rooms closed for the duration of the summer. So student athletes should not be going into locker rooms. In spaces such as this, the new gym, also over at the track and football field, we will have one restroom available per gender so that students need to step in there and use those areas. They have them available to them. Also, if you look over here, our water fountains. So we are asking that students bring their own water bottle to each one of their practices, or if they're working with the band or working with chorus or one of the other activities that we have available to them at the high school and middle schools, that they bring their own water bottle. We're not going to allow students to use water fountains, with the exception of this. If there is a water fountain that has a bottle refill, that will be available to them for use. So no locker rooms, we'll have restrooms, and then water fountains not available unless they are filling up a water bottle.
Hi, I'm Nurse Brenda. I'm the nurse at Liberty Park Elementary School, and I'm going to be talking to you today about student and staff symptom monitoring. When the students first arrive on your campus, it's a good idea to just notice how they look. Just do a visual inspection that day. Notice if they have rosy cheeks, or sometimes students with fever might have that sluggish, fatigued look, maybe glassy eyes. Just notice how they look. If you think there's something going on with that student that's unusual, that might be a student you want to check their temperature. Other signs of illness you're going to be looking for during the time that the students are with you are chills, cough, shortness of breath, muscle aches, headaches, sore throat, runny nose, nausea, vomiting, diarrhea. Any of those symptoms would be the time that you'd want to check their temperature. The no-touch thermometers run a little warm, so just know if you take a student's temperature and it's above 100.4, it might be a good idea, especially if the student's been exercising, to just let them cool down for a few minutes in a cool place, maybe drink some liquids, and check that temperature a couple of more times, because those thermometers, especially if you've been exercising, you're going to get a warm reading. If the student happens to be above 100.4 Fahrenheit, that would be the time that we would want to send that student home. We would quarantine that student with an adult. You would each wear a mask in the health room of your school. And the parent would be notified that the student has a fever and needs to be picked up. Several things that we need to think about to prevent sharing this virus, or any viruses. in elementary school, we teach the student, don't touch the T-zone, like an uppercase T. You don't want to touch the eyes, the nose, or the mouth with our hands. That's how probably 99% of viruses are shared. We get the germ on our hand, we rub our eyes, we rub our nose, we touch our mouths, and we share that virus, and then we become ill. So no touching the hands to the face. Also, you're going to want to wash your hands a lot more than normal. You're going to want to use hand sanitizer if you don't have a way to wash with soap and water. When the students first arrive, and staff, when you first arrive, it's a good idea to go on and use the hand sanitizer or wash your hands. Every time you take a break, it would be a good time to use the hand sanitizer or wash again. Also, if you have gone to the restroom or about to do something touching your face, let's use the hand sanitizer again. The other thing we can do to make sure we're not sharing our germs with others are definitely the cough in the elbow into the clothing, or coughing down into your shirt, or sneezing. Keeps the germs from spreading that 6 to 8 feet that spray can travel. Anytime you're around another student or another adult within 6 feet inside a building, we definitely want to wear our mask. If you're outside, that's 6 feet in front and back and to each side. As long as you stay that far apart, you're okay. But if you're any closer, then you need to have a mask on, and the student needs to have a mask on. We need to think about our students with pre-existing conditions. We have students that have diabetes, that have lung conditions like asthma and other chronic conditions. Definitely some of the autoimmune or compromised immune system diseases. We need to make sure we've had that conversation with those parents to make sure they've asked those pediatricians, is it okay for that student to participate at this time in the activities that we expect them to? And adults, I want to remind you, we have to be the example. These things seem very stringent and different from what we're used to, but if we prevent the spread of this virus, the sooner we'll be able to get back to what we know is normal.
Let's talk a little bit about what's going to be available to coaches as well as sponsors, and what coaches and sponsors are going to ask for their student athletes as well as other participants to bring. So what's going to be available to coaches and sponsors? Each coach and sponsor will receive a spray bottle such as this with a trigger, and I'm going to take you through the process for filling those up and how we're going to use those. Coaches and sponsors will also have, in the different areas around the schools, the hand sanitizer, and we're trying to get those as big as we possibly can. But every time a student enters the gym at the offset of practice, or the band room, or the chorus room, we're asking that the sponsors and coaches make sure that they do put some hand sanitizer on their hands. Likewise, after practice or the event is complete, what a student needs to do, or student athlete, as they exit, they need to come back and hit this hand sanitizer one more time. Again, the system will be the one that's providing the hand sanitizer for the coaches, sponsors, and our students. Masks. In terms of masks, you heard Nurse Brenda talk a little bit about the masks. We are asking student athletes as well as other participants to bring their own masks. And there are different types of masks that are available to them. You've seen these used out in public, as well as masks such as this. We'll need our coaches and our sponsors to be good examples and make sure that they've purchased a mask as well. Masks are not to be used, or do not have to be used rather, when you are not within a 6-foot parameter of another individual. So for example, if you are doing a 3-man weave drill here in the gym, as long as you have that 6-foot spacing, a student athlete would not need to wear a mask. However, once student athletes come in together, or individuals come in together in another activity for instruction or to have discussion or conversation, within that 6-foot parameter, we are asking that our students wear a mask such as this. That is going to take some scheduling. That is going to take some logistical maneuvering by our coaches and our sponsors, but as I said at the offset, we do appreciate you working with us to make this the best experience possible. So we've talked a little bit about the masks. We've talked about students coming together. We should not have students huddling up with one another. Coaches, that's going to be very difficult. I think about whether you're coaching basketball, whether you're coaching football, asking students to take a knee right there around one another to provide instruction, motivation, or some other conversation. That is something that we have been issued guidance through the frequently asked questions from our state association that we should not have huddles. It's also going to be difficult. We should not have student athletes close enough to one another where they're giving high fives. That is something that's been provided as well as part of that frequently asked questions document. So this is a change in our business. This is not business as usual. So we're asking coaches to work with us on that in terms of the logistics. All right, so talked with you a little bit about the spray bottles as well as the trigger that we're going to be providing each one of our coaches as well as our sponsors. We're here in one of the restrooms here at the new gym. I'm going to show you real quick what we're going to do in terms of filling these up. As I mentioned earlier, each one of our coaches and sponsors will receive one of these spray bottles. Just remove the top of the spray bottle with a twist, take the trigger off. You'll walk up to one of our DCS systems if you're here in the gym at the high school. The DCS system is between the restrooms. We will come over to the nozzle. You'll just twist the nozzle to disinfectant. It may say restroom disinfectant or just disinfectant. Make sure that the water hose is hooked up. Place that underneath the nozzle. You can see that here. The water should already be turned on, and you just press the side that has the spray bottle on it. You should then fill up your water, re-engage the trigger, and now you're ready to step into the certain spaces that we're asking you to clean for us. Coach Seegers has made sure that he has separated practices with a 30-minute window. So one practice will be complete, students will exit the campus, and then we will have a 30-minute window where we're asking coaches to go around and hit certain areas with this nutrigermicidal cleaner. One area of note that I want to make sure you pay special attention to, all you need to do is walk up, spray the area, and you can walk away. The disinfectant basically takes care of itself. No need to wipe or remove that from the certain spaces. It needs about 10 minutes. So the disinfectant needs about 10 minutes of sit time in order for it to activate. Each morning, we're going to have our custodial teams coming around to the different restroom areas. They're going to use one of our Clorox 360 mist machines here, and they're going to spray each one of our restroom areas and make sure that it gets a thorough cleaning as well. So we mentioned the 30-minute window. The nice thing about us going with a universal cleaning product across our entire system, everyone has access to the nutrigermicidal cleaner. What we're asking you to do in that 30-minute window, you, one of your assistants, someone that's helping you as sponsor, is to make sure you go around and spray every area where you may have had student hands hit. So for example, we're here in one of the restrooms outside of the new gym. Walk up, student most likely, wash their hands, spray here, here. So those would be the areas that you would look to spray. Here in your gym spaces, if you have students that are sitting in certain areas, you want to make sure that you get the backs of seats. If you've pulled equipment out, you want to make sure that you have the equipment out between practices. You're spraying each one of the areas. You'll be doing the same thing on the football field. If you have equipment you've gotten out over there, I'm thinking about track and field, you'll pull out hurdles. You may spray down those hurdles as well. So those are different things that you need to do at the completion of each one of your practices. I know when you are getting a gym floor ready for a practice, you may go through and have either one of your students, your managers, one of those individuals sweep the floor. You want to make sure that you get those handles as well, and then get that appropriate 10-minute sit time so that that disinfectant can activate. Through the state association and Coach Seegers, we will be providing each one of our head coaches and our assistants with a checklist, and they will need to make sure that they go through that checklist at the beginning of each one of their practices. This checklist is going to talk about things such as COVID-19 related symptoms that student athletes may be experiencing, and we need to make sure that we are monitoring them before each one of our practices. Finally, coaches, sponsors, other individuals that are helping to support our students. This is, as I mentioned at the offset, an unprecedented time here in our school system. And I want to make sure that you know from Dr. Freeman, our Board of Education, and all of us here at Vestavia Hills, we are certainly very appreciative of all of these efforts above and beyond what you have done in the past. So on behalf of myself as Assistant Superintendent, we want to make sure that we say thank you.